Understanding transitional cell carcinoma grading. Transitional cell carcinoma, often referred to as urothelial carcinoma, is a prevalent form of bladder cancer that starts in the transitional epithelium, which is the lining of the bladder. Grading transitional cell carcinoma involves examining the cancer cells under a microscope to see how much they differ from normal bladder cells. This grading helps predict how the tumor might behave and how aggressive it could be. The grading system used for transitional cell carcinoma is primarily based on a three-tier classification established by the World Health Organization. The first grade is Grade 1, also known as low grade or well-differentiated. In this category, the cancer cells look quite similar to normal bladder cells. These tumors typically grow slowly and are often non-invasive or only superficially invasive. Because of this, they are less likely to spread or come back after treatment. Next, we have Grade 2, which is considered intermediate grade or moderately differentiated. Here, the cancer cells start to look less like normal cells and show moderate abnormalities. Tumors in this grade have a greater chance of invading deeper layers of the bladder or recurring after treatment. Grade 2 can be further divided into low or high grade based on specific features of the cells. Finally, there is Grade 3, known as high grade or poorly differentiated. In this case, the cancer cells appear very abnormal and disorganized. Tumors at this grade tend to grow rapidly and are more likely to invade the muscular layer of the bladder. They also carry a higher risk of recurrence and metastasis, which means they can spread to other parts of the body. A specific type of high-grade tumor is carcinoma in situ, which is a flat, non-invasive tumor that is still considered aggressive. When pathologists grade these tumors, they look at various cellular characteristics, such as the size and shape of the nuclei, how often the cells are dividing, and the overall structure of the tumor. For instance, Grade 1 tumors show minimal abnormalities and rare instances of cell division, while Grade 3 tumors exhibit significant abnormalities and frequent unusual cell divisions. While the grade of the tumor gives insight into how aggressive the cancer cells appear, it is essential to understand that the tumor stage is also crucial. The stage describes how far the tumor has invaded into the bladder layers and beyond. Generally, early stage, low-grade tumors have a better outlook and may requiring less aggressive treatment. In contrast, high-grade or invasive tumors often need more extensive therapy. Understanding the grading of transitional cell carcinoma is vital for managing bladder health and bladder cancer. It helps healthcare providers determine how closely to monitor the patient, what treatment options to consider, and how to counsel patients about the risks of recurrence and progression. Accurate grading is achieved through biopsy and examination by specialists, ensuring that patients receive the most appropriate care tailored to their specific situation.